Mr. President, thank you. My rise today to talk about my amendment, Heller Amendment number 288. My amendment reinforces the important role Medicaid has played in my home state and the state of many others of my colleagues that are here today. Let me tell you the impact Medicaid has had on the state of Nevada. And as many of you know, the state of Nevada was the first to expand Medicaid. Before Nevada made that decision, the state's uninsured rate was at 23%, and it was one of the highest in the country. So think about that for a minute, Mr. President. 1 in 4 Nevadans did not have health care coverage. Under expanded Medicaid today, Nevada's uninsured rate is between 11 and 12%. I've also seen the number of uninsured people living in Nevada's rural communities cut in half. And I've seen major gains in the number of children in our state with health care coverage. In fact, Nevada has seen one of the most significant decreases in uninsured children in the country. In 2013, our state had the highest rate of uninsured children in the country. We were ranked 50th in the nation. Now I can proudly say that Nevada is the most improved state when it comes to addressing our rate of uninsured children. Our state had made significant progress since the state's decision to expand Medicaid, and that has made a big impression on me. Over the past few months, I've had the privilege of meeting with Nevadans here in Washington, D.C., back at home also to discuss health care. The resounding message that I continue to hear is that because of Medicaid expansion, more than 200,000 Nevadans have health insurance today who otherwise wouldn't. The other resounding message I hear is that drastic cuts to the Medicaid program threatens the critical services that Nevadans rely on. Let me read you a letter I received from a woman in Las Vegas. And she said, "My oldest child has Down syndrome and has depended on Medicaid since the day she was born, was denied health care because of pre-existing conditions that she was born with. My husband and I are hardworking Americans. We started our own business 5 years ago and have seen that business grow more and more each year. We do not rely on the government for assistance other than Medicaid coverage. Without it, we would be unable to afford the numerous appointments with specialists and surgeries that keep our daughter happy, healthy, and progressing in life." This is just one example of the real stories behind the numbers. And I want to do everything I can to make sure that they are protected and that their coverage isn't threatened. I want to make sure that their daughter has health care coverage today. And I want to make sure that their daughter has health care coverage tomorrow. Medicaid also plays a crucial role in Nevada when it comes to covering the elderly, people with disabilities. More than 30,000 Nevada seniors receive health care through Medicaid, including nursing home care and services that help them live at home. In fact, more than half of Nevada's nursing home residents are covered by Medicaid. And nearly 50,000 people with disabilities in Nevada now have access to care that helps them live independently thanks to Medicaid. Karen from Henderson recently contacted me and said that her adult son has MS and depends on Medicaid to help cover the cost of medication that costs $300 per month. Without Medicaid, he can't afford it. One of Nevadans traveled all the way from Las Vegas to talk to me about her 2 sons with cystic fibrosis. She's worried about any legislation that would jeopardize access to care for people with serious chronic illness like the ones her sons are struggling with. In total, over 631,000 people in Nevada are covered by the Medicaid program. That's low-income children, pregnant women, seniors, and people with disabilities. And it's why I've said since the beginning of the health care debate that I will only support a solution that protects Nevada's most vulnerable. The House bill didn't go far enough to do that, and neither did the Senate's bill. And that's why I voted against it last night. Nevada faces unique challenges when it comes to health care. I've spent the past few months trying to find ways to protect the Nevadans who depend on Medicaid, preserve coverage for those with pre-existing conditions, all the while bringing down costs and improving quality and access to care. I've also been having discussions with Nevadans in Washington and back home to hear from them how potential changes could impact their care. Whether it's a mom in Reno who has a son with a heart condition and is terrified about the future of his treatments, or the nurses from Las Vegas who came all the way to D.C. because they're worried about that their patients will lose coverage, I've been listening and I do understand. Make no mistake, Obamacare needs fixing. It's led to higher costs and fewer choices in my state. For the past 7 years, I've said that we need more competition to drive down costs and increase choices for Nevadans. My discussion with Nevadans in Washington and back home have also allowed me the opportunity to hear from them how potential changes could impact their care. I believe we can achieve these goals while recognizing the role that Medicaid plays in our states in ensuring that those who have coverage today are protected. My role as a United States Senator is doing the very best I can for my state, and that's standing up for Nevadans who depend on Medicaid. We're having this debate because I do believe that there are common sense solutions that could improve our healthcare system, and I voted to give us the opportunity to have that discussion and to fight for them. But as I've said all along, healthcare reform cannot be balanced on the backs of Nevada's low-income families and sickest individuals. That's something I cannot and I will not stand for. We can work to find a way to lower costs, increase choices, improve the quality of care for Nevadans everywhere. But we can do it in a way that also protects our most vulnerable. That's why for the past few months, I've been working with my colleagues here in the Senate, who also understand the unique challenges expansion states face. And we've been fighting for solutions that will protect those who currently rely on the Medicaid program. It hasn't been easy, but that's the way it's supposed to be, and that's okay. I'm here to roll up my sleeves, get to work, fight for policies that will be the best interest of all Nevadans. So I encourage my colleagues to vote to support this amendment, Heller 288 today, to reiterate the value of Medicaid in our states, and that we have much work to do ahead of us to improve the healthcare system for Nevadans and Americans across this country. Mr. President.